You have joined the meeting as an attendee and will be muted throughout the meeting.
So we'll start. This is the August 4th, 2022 meeting of the Gloucester Board of Health. It is just past 5:30 in the evening. This is a hybrid remote meeting. And consistent with Chapter 107 of the Acts of 2022, this meeting will be conducted by remote participation. The public can't physically attend the meeting, but every effort will be made to allow the public to view and listen to the meeting in real time and participate when necessary. Additionally, all votes by the board during this and future meetings will be by roll call vote. If you are calling in on a phone, you can press *9 to request to speak. If you are watching on a computer or other device, there is a raised hand button that you can tap or press to request to speak. Please use either of these options during oral communications to be recognized to speak. The listing of matters is those reasonably anticipated by the chair, which may be discussed at the meeting. Not all items listed may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. And then lastly, the order of the agenda can be modified at the board's discretion. So first, we should introduce ourselves. My name is Joe Rosa. I'm the chair. Eric?
Eric Kaplan, member of the Board of Health.
Claudia?
Claudia Schweitzer, Vice Chair, Board of Health.
Kelly?
Kelly Highland, Board of Health member.
And I guess Don is not present at the moment. But we do have also in the meeting, Rachel, you could introduce yourself.
Sure. Rachel Boyle-Toller, Assistant Director of Public Health.
And Kate, are you able to speak?
She may have stepped out.
Okay,
Oh, no, I'm here. Kate Cunningham, public health nurse.
good, thank you. And Bobby Orlando, and also we have Joyce Redford. Joyce, say something so that it gets, your voice gets recorded.
Hello, I'm Joyce Redford, the Director of the North Shore Cape Ann Tobacco Control Program.
Great, thank you. The next item on the agenda is an opportunity for public oral communication. The public may speak up to 3 minutes on an item which is not on the agenda. Is there anyone wishing to speak?
We do not have any raised hands.
Okay, seeing no one. The first item on the agenda is the approval of minutes of July 7th meeting.
I make a motion to approve the minutes for the July 7th meeting.
Second,
Eric seconds. Any discussion? Amendments?
No.
All in favor of accepting the minutes of July 7th?
Aye.
Aye.
We have to do it by roll call, I guess. Eric, you vote yes?
aye, yes.
Correct. Claudia,
Yes.
Kelly,
Yes.
and Joe Rosa, yes. The meetings of July 7th are accepted. The next item on the agenda is one committee report, the interview committee update. I guess Claudia, you can address that. There's not an awful lot to say at this point.
We have a finalist for the health director position. Joe, I'm not sure, is there?
I believe the final negotiations are tomorrow.
Okay.
According to what Jill emailed me. So there's nothing to announce as yet, but we're very close apparently.
Yeah, so we've chosen somebody and the negotiations in terms of the details are in the works right now.
Good. The next item on the agenda is new business, and it regards, first item is Good Harbor Liquors at 340 Main Street regarding a tobacco violation.
Yeah,
Is Joyce gonna
sure.
report on this to start with? Joyce, the floor is yours.
I can present the information. So on May 16th at approximately 1:40 p.m., a youth was sent into Good Harbor Liquor and asked for Newports, and they were sold. There was no ID asked for or requested. She was able to purchase a pack of Newports, and it was the first violation. They were sold by a female, adult female, blonde hair, ponytail, derma piercing on her face, and a purple sweater.
Very good. Mark, are you representing the,
Good evening, Mr. Chairman. My name is Mark Nestor, and I am in fact representing Dina Hanna, who, by the way, is also here
Hi.
with me. She is the owner of Good Harbor Liquors. Oops. And I just lost us. Hang on. Can you still hear me?
Yep.
All right. Well, I'll proceed while as long as you can hear me, and I'll try to get the picture back. I'm technically challenged, so we'll wait and see.
We can hear you.
Join the club.
And that hurts. I need my son, the technician, around. As Joyce pointed out, my client has been in business since 2013. This is the first violation she had. In some defense, the clerk that was working that day, Joni McKay, who was the one who sold the cigarettes to the young woman, who's been there a while, but unfortunately, the prior week, she lost a relative. So although she was working, she was somewhat distracted. My clients has maintained to try to teach all the employees, they have to card the people, they have to be careful. Unfortunately, this one slipped through the cracks. I was going to ask Joni to come tonight to talk about what happened, but unfortunately she lost her cousin on Monday, so she's in grieving again, so I couldn't bring her here. My client is clearly aware of the requirements of the state and this local board, and she's been very vigorous in trying to ensure that something like this doesn't happen. Unfortunately, it happened. She sent a letter to the Board of Health on July 14, 2022, before I got involved, essentially saying what the effort she's done. She apologized to the board for the oversight. She promises she'll be extra vigorous and vigilant with her employees, and again stressed that you need to card. You just can't presume it's too dangerous. And she is representing the board that she will do everything in her power to make sure this doesn't happen again. And she would ask the board to take this in consideration. Again, she's been in operation for almost 9 years, and this is the first violation she's had.
Joyce, can you refresh at least my memory and perhaps other people's about the change in the penalties that have recently happened?
So, am I on? Hold on. I'm on my phone. Okay. So in June of 2020, state law went into effect. And state law is the lowest threshold. In some cases, the city of Gloucester has gone above state law, which is authorized, but the lowest threshold is that $1,000 fine shall be issued. And I will say, just because of the date of this, May 16th,
16th.
she is required to pay $1,000 fine, but at effective July 1st of 2020, the board voted to additionally have a 3-day suspension, which would be post this compliance check. So there isn't a 3-day suspension with this violation, but state law does require a suspension with even a first violation. But given that the board didn't vote on that until or enact that until the July 1st date, that wouldn't be imposed. But the $1,000 fine is the state minimum, and it actually says shall be. So there's very little wiggle room for the Board of Health in terms of the legislature feels like a sale to a minor is a significant violation. And I do concur. This is her first violation, but unfortunately, this is her first violation of a sale to a minor, and that's the state law, the minimum state law.
I understand the board's conundrum in the state position. I would just, again, appeal to the board. My client has operated that business for 8 years. She's operated successfully. This was a hiccup. There were extenuating circumstances, in my opinion, because of who the employee was that was on working that day. She was distracted, and I would have just appealed to the board if there's any way that any other relief can be granted. I would ask the board to grant that relief.
If I may, we also uncovered through this process that the Good Harbor Liquors is not licensed with the city to sell tobacco.
Oh.
I was just made aware, she's had a state license, as I understand, since 2013, and she didn't understand that she required a local one. I'm gonna try to work with her to apply for one. I was under the understanding, and again, I came in late, the potential that was being raised before the board tonight, but I looked at the paperwork, apparently that did not make it before the board, at least according to the agenda. So I'm gonna have to bring that back before the board at a later date.
Well, and I would.
And I
just add to
understand there's
that-
some issues out there, so I have to do a little more digging.
Well, and I would just add that if that is the case and we were unaware of that, that holds its own violation, operating, selling a tobacco product without a valid license at the local level. So the board can choose to do what they want with that, but the violation occurred. The sale was made to a minor.
Well, the licensure affects the department's enforcement approach. So it's very related as far as the department's perspective.
So it sounds like, in other words, they would be lucky at this point to get the $1,000 fine for violation, because there's other violations as well.
Correct.
And so maybe we can split the difference and just say the $1,000 violation.
I would request the board to allow my client to speak briefly to the board, if they may.
Sure.
Yeah.
Hello, everyone. So, yeah, I agree that something wrong happened, but this has happened. I thought that I already have the license, and I always update my license. That's all I know. And I've been checked every 6 months. Someone from the city or the state, I don't know, someone come and check and take a picture of my license, and no one told me any times that I don't have a license or I'm missing anything. So I think, yes, it's my mistake, but it's not only my mistake. It's like sharing mistake, because if I've been selling for 10 years and no one stopped by, no one told me anything, it just, yes, it's my mistake, but it's not only my mistake, because you keep sending people checking for like underage, and I never fell on anything. I never had any violation. So what do you think? It's only my mistake, or it's double mistake from both sides? I don't know. Like, I think it's like there's something wrong here. I agree. It's a mistake, but
I think that's a separate issue. The issue on the agenda is really the sale to minors. And my own opinion is that we need to enforce what we agreed to being the state's minimum fine of $1,000. Any other comments from the board?
No, I agree. If we can, I don't know if we need a motion or something to do that, but
so
Sure.
can I apply for a license?
Pardon? I didn't hear that.
I'll address it later on with my client.
Well, if I could to the chair, if there is no local license, she actually should not have tobacco for sale at her establishment at this time. The product should be moved out of the location because she doesn't have a permit. And I will say that we've conducted inspections at this location, and typically when we go in and do an inspection and there is a state license and not a local license, we give some lenience and just say you need to make sure, assure that there is a local license that is posted so we can see it. So I would just advise the board that if there's no active license as of today, while her business in operation, she should not be selling tobacco. She does not have an active permit to sell tobacco to anybody.
Well, certainly the department can handle that enforcement. Regarding the violation itself, do we have a motion? Sorry? Well, somebody's wanted to speak. Regarding the violation itself, I would like a motion that we impose the fine of $1,000.
Second.
Is there any further discussion from the board?
No.
No? So I approve the motion. Eric? Eric, we're taking a vote.
Yes.
You seem to be hung up somehow. Claudia,
Yes,
Kelly,
Yes.
Eric, can you hear us?
Yes.
Yes, Eric votes yes as well. All right. So the fine is imposed and the department itself will address the lack of a license and whether or not materials can be moved out of the facility until a license is obtained. Other new business. The Biosafety Committee. Now this is my call.
Thank you, everyone. I'm going to leave the meeting. I'll be in
Yes,
touch.
thank you. Thank
Thanks,
you.
Joyce.
Have a
Appreciate it.
good night.
you too.
So, Rachel, if you can get that presentation, I will be as brief as possible since I've mentioned this last time, but it's probably worth the board getting just an overview of the regulations that were passed over 10 years ago in anticipation of some biotech activity happening in Gloucester, and there is such now. And so as you'll see, one of the things that we need to do is put together a biosafety committee. But before I get to that, let me just run through these slides. And just say that, the manipulation of nucleic acids, DNA, and RNA has been going around the world now for more than 4 decades. Biotech research itself is not intrinsically dangerous. Next slide, please, Rachel. However, it's possible to do dangerous work. And I listed a couple examples there. And because of that, the NIH, a long time ago at the onset of modern biology, recognized potential dangers and regulated all recombinant DNA work at a level that was appropriate to the risk to workers and or the community. And if you're interested, you can find those regulations in a very extensive document called the NIH Guidelines, which you can find on the web. The Gloucester regulations are subordinate to the NIH regulations, but they restrict the kinds of work that can be done, the next slide, that can be done in Gloucester, and thereby hopes to assure the public that the guidelines are being followed for the work that is allowed. And the regulations obviously also will provide the public with a group, this biosafety group, to address any questions rather than having the individuals go to companies or institutions. And then lastly, people often think that this is going to inhibit companies from wanting to come to Gloucester. That's not true. Most cities and towns have such regulations, and they're useful because it makes it easier for companies and institutions to confirm their compliance. So the Gloucester regulations call for the creation of a biosafety committee for the purpose of overseeing all the allowed uses of recombinant methods in Gloucester. And they will also advise the Board of Health. The committee comprises 5 members, the board chair or his designee, the health director or designee, and 3 members of the community. 3 members of the community have been identified, and they are to be appointed by the mayor and ultimately approved by the board. And right now, those names are in front of the mayor, and hopefully they will be appointed and at the September meeting, hopefully approved. Next slide. This is a level of detail that we probably don't need to go into very much. There's 2 levels of work. The work that's not dangerous at all, that might be going on in the high school, for instance, is called exempt and only requires a registration with the committee. More extensive work requires a permit. And once we get going, we will begin accumulating permits and registrations. The last slide is mostly for information, just to convince or satisfy the public and the rest of the board that the levels of work allowed in Gloucester are only at the exempt work, the sorts of things that might be going on in high schools, for instance, and what's called BL1 and BL2. And you can see here those that are associated with risk levels 1 and 2. Risk level 1 meaning that there's no likely disease associated or harm associated with that work. BL2, agents could be used which cause human disease, which is rarely serious and for which interventions are allowed, are available. Higher levels of work, BL3 and BL4, are much more serious kinds of work that require much more extensive regulation, both physical and operational. And those are not allowed in Gloucester. So hopefully at the next meeting, we will complete the approval of this biosafety committee and they can begin their work. We will have, I would love to participate on this, but I'm very associated with the Gloucester Marine Genomics Institute, which through its academy is doing a lot of this work and would be one of the prime regulated institutions. And so I would have to recuse myself from everything. Plus, one of the 3 volunteers is in fact Maggie Rosa, my wife. And so I will have to, hopefully one of you other board members will volunteer as a participant. This shouldn't be much of a heavy lift. It should be fun to actually hear about what's going on in the community. But you've got a month to think about it. Any questions before we move on?
Is there anything we need to do tonight, Joe, in terms
No,
of voting
this was
on
all
anything?
informational.
Okay,
All informational, and at the next meeting, hopefully, all being well, we will approve with 3 community people and identify the other 2 board members, members of the committee. Anything else?
no,
Okay, old business. What's first? Body art regulations.
I'll be updating the board on behalf of Regray. We've started a bit of a collaboration regionally with other towns to figure out best practice in this regard. And currently, we're waiting to hear from Marblehead, I believe, from their public health nurse and their health department on a meeting that they're having on this topic. And they're going to inform us of what was discussed and Bree is doing a great job communicating with surrounding communities so that we have some consistency in how we enforce things in the region. So right now we're waiting.
Any other questions, comments?
Just, I think it's great to do a regional approach.
Yes, I agree.
Yeah.
Good.
Yeah.
Strategic planning. Who is going to address that? Kelly, are you still paying attention to what's going on there?
I think it was left at waiting for the new health director to come on board, to then kind of get a feel for the land and whatnot. So it's kind of on hold.
Was there, as I recall, perhaps it was the last meeting or a meeting before, there was some indication of monies being available to get a legal
Consultant, yeah. Consultant. So I don't know what the status is of that. I know it's still moving forward. I think Jill is working
Okay.
on it. So then,
To the
Yeah.
ARPA, I believe.
yeah,
Okay,
Yeah, I just say, in our interviews, that was discussed a lot, and Jill felt very strongly that there should be a consultant.
okay.
So we then, of course, said, well, great, give us the money.
Right. Anything else?
No.
no.
Next item, BioBot reporting and contract. Is there anything we can say there?
No, I think we're moving forward. We're moving into a new contract for the COVID workers. And I think they're changing the number of task kits that we get ahead of time so that we don't run out.
Right.
And I have a meeting scheduled for Monday with BioBot to discuss those details further so that I'm kept apprised of everything going on moving forward.
Yeah, those of you paying attention to the numbers know that we haven't gone to zero, and obviously it isn't zero because people keep getting infected. So people should remain vigilant, and if they are not yet fully vaccinated, they should attempt to become so. Which brings up the next item on the agenda, the COVID-19 response. Is there anything to update there?
So right now we have 29 active confirmed cases. Kate Cunningham, our nurse, has been doing a great job updating the public about best practices. We are seeing, again, like Joe said, that our numbers are not zero. We still have some folks are getting sick, a couple hospitalizations recently. And so Kate did put out a Facebook post recently, just encouraging folks to be extra careful around their immunocompromised and elderly family members and friends. And also forwarded the communication from the state in terms of getting your booster when eligible. So we're continuing to communicate with folks. Flu clinic season is right around the corner, so we're also preparing for that. And trying to figure out what that means in terms of early vaccines as well.
Has the state communicated anything to the department regarding the monkeypox?
Yes, and I would have Kate speak on that if you don't mind jumping in.
What would you like to know about monkeypox?
Is anything actively happening? Are there discussions of vaccine distribution or anything like that?
So at the moment, there are currently on the mass.gov website, there's a list of locations where you can go to get monkeypox vaccination if you believe that you have been exposed. It's not, there's nothing in the North Shore. However, there has been discussion about expanding the supply of monkeypox vaccine and having more distribution, but there's not a set date for that yet. It is not going away quite yet. There have been a few cases in the North Shore. There's also some questions, since there have been a few pediatric cases, about the potential for it to become, there's some discussion of whether or not if you have pediatric cases, it might start spreading once school starts. So that's something that a lot of folks are keeping an eye on.
Right, so we should put that on the agenda on an ongoing basis, just to make sure that everybody's paying whatever attention they have to. Anything else, Kate?
On that end, we're mostly just waiting to hear from the state the direction they would like us to go with that, but it does seem like it's going to be something that carries on into the fall.
Right, right. Any other comments on that or questions? Otherwise, we go to our favorite topic.
My favorite topic, at least.
Did Kelly, did you have something?
Oh, sorry.
That's all right. Yeah, I was just on the same vein as monkeypox to just reach out to our high-risk populations that are, we're finding that the monkeypox is more prevalent. So establishing those relationships and contacts now would be good in preparation for any potential vaccines that will be coming. I think really the closest vaccination sites are Lawrence, I believe, and then Fenway Health, and kind of more towards the city. And so I work for North Shore Community Health, and so we don't have access to the vaccine either. So it looks like they'll start to increase those opportunities to get the vaccine closer.
Good, thank you. The next item, Good Harbor Beach, Good Harbor Creek.
Yes, so we're still closed right now. Unfortunately, my only update is that we were waiting for rain so that I can do testing. Very unfortunate timing because we are in drought conditions. I need at least the very minimum half an inch in an hour. And it has to be maintained for a certain amount of time, and then I have to go out. I have my weather radar going, so that even if it happens in the middle of the night, I will be out there. And there's 6 locations throughout the marsh that I'll be taking several samples on. Just so you're aware, the samples are enterococci, what we normally test for. And then there are 2 other bacteroides samples that will give us a more in-depth DNA analysis of the type of bacteria we're looking at. So not just will we be able to confirm that the bacteria is coming from where we think it's coming when the rain happens, we'll also be able to confirm that it's human, that there are human markers in it, and where the avian bacteria is that we're concerned about. Again, we're quite confident it's a human source, but we'll be able to have the DNA analysis to confirm that. So that's exciting, but we are waiting for the appropriate weather. The other thing I will say about the creek is that the questions that we most commonly get are, is it closed? Yes, it is. The beach is absolutely safe. Water temperature and water circulation starting at the beach, the mouth of the creek, makes it safe, makes the dilution of bacteria sort of ongoing as the water moves and cools down. And then the other question we get is, why are we not testing the creek weekly? And just to clear up information about that, we typically test our public bathing waters on a weekly basis. We decided to stop testing the creek. We don't want there to be any confusion in the public about the standing of the creek. There are certainly times where we might test the creek in the morning, and within hours, the levels of bacteria could change to an extremely unsafe level. So we want to make sure we're consistently communicating that the creek is at risk to be polluted and to exceed our safe limits for bacteria. So that's the message that we're sending. That's why we've paused testing right now. We also know what we're going to find. We don't find that data especially useful because we're just trying to understand wet weather sampling at this point and not dry. So that's what we're doing. I fully expect to have answers within days after a rain event, and we'll be working after that to set up a presentation to the city with our engineers and our biologists, Flutter and Curran. And I'm very excited to expose you to those folks because they're incredible. So I'm on it and I'm watching the weather.
All right.
Thank you, Rachel. Sounds like you're ready to go if it rains, like as we all are for
I
different.
got my waders. We made in the office, we made a painter stick scooping device with like duct tape and rope, and it's under the direction of the engineers. So it was really, we are ready. We are definitely ready, and you're very welcome.
Other comments, questions? Last item under old business is the pest control issue in the public schools.
Yes, we have had no significant movement on this piece, unfortunately. My recommendation would be to form a committee moving forward with representation from the health department and also the school committee and also DPW. We're happy to provide as a department guidance on pesticide use. However, we would never want to act without being in tandem with the other departments involved with the schools and with the maintenance of the schools. So it would be my recommendation. I'd be happy to take charge of organizing the proper communication in that regard.
I think that's the right approach, particularly getting on board with the school committee is important.
I'm just, when you say you haven't gotten anywhere, what does that mean? That you haven't been able to get any more information from the DPW or whoever about who has the contract and what they're putting in? And
Yes, yeah, forgive me. So the last meeting, we were able to reveal the chemicals
Yeah.
that were being used in the IPMs. And also we had copies of the specific contract with pest control companies from recent years. So we have that information. The reason that we have not moved forward in a meaningful way right now is mostly because the school committee and school administration really particularly is on break right now. Ben Lemus is away, and he's somebody I'd want to communicate with at the beginning of taking action. So so we're waiting for people to get back, and that could absolutely be a priority for the next month.
Great, thank you.
Yeah.
Anything else? Any other comments? Let's move on to the assistant director's reports.
Yes, two exciting pieces of news to report in terms of staffing is that we have made an offer that was accepted to hire a prevention director. I believe I mentioned that briefly last time. Chelsea Goldstein Walsh has accepted that position with the city. She has a background in primary prevention, and we are so delighted to have her continue her prevention work for the city of Gloucester. She comes from the town of Medway, where she did very similar things for the town. So very qualified, has incredible energy. I will make sure that she's at the September 1st meeting, and I am confident that you will all be as excited about her as we are in the department. Also, we have had interviews for the Title V inspector position, and we have made an offer to a candidate. So very exciting. That's in the beginning stages of negotiations, but I'm very hopeful about that, and we're excited to have an even fuller team very soon.
Great. Any other comments or?
Just that we are chugging along without Max, who we miss very greatly. And it's a time of transition, but everyone's working very hard and making you all very proud. And we are starting to think, I think I mentioned this before, but about flu vaccine season, just trying to be proactive about that. Also, we are involved in a English learners resource group in tandem with the school committee, school administration, pathways, community development, and several other representatives from around the city. And those are sort of the primary things going on with the department. Certainly there's lots of summer events. Jake and Bree are on the call here, and they've done an incredible job covering that. Jake, being his first few months in the department, taking the primary responsibility for event inspections, and we're really quite grateful for that. So we're just chugging along, busy season for the health department, and it's certainly tough to lose Max, but we are a good team.
Comments, questions?
Nope, just, thank you for holding the fort, doing the directors and the assistant director job right now.
It's my pleasure. I couldn't do it without any of the people who we currently have. So
great.
Very grateful. Oh, I'm sorry. I do have a raised hand. I believe Mary Ann Boucher was hoping to speak.
Sure.
Forgive me. Hi, Marianne.
Thank you, Rachel, Marianne.
Sorry I didn't see you sooner.
Hello, Marianne Albert Boucher, 93 Mount Pleasant Avenue. I'm really disappointed. This is, like I've said, numerous meetings. This has gone on for well over a year, and it just keeps being pushed, or the can is kicked down the road every month. And we're dealing with children. And how much longer do we have to wait to get these answers? And I know that Eric spoke asking for the list in the schools. Was the list presented for the schools? I know I have the list. I know that I have the purchase orders for these items. Where's the contract? Is there a contract? Has there been a contract? Is it a current contract? When was the last time there was a contract? This is my granddaughter. I'm so tired of waiting to find out if the children in our schools are going to be safe or not. And I don't think that that's unreasonable. I think that waiting well over a year and a half has been extremely reasonable. And you know, the superintendent's away. I can't get an answer, and I have never been able to get an answer from a school committee member, from the superintendent, from the city. The only person or the only people that I've gotten anywhere with the help with this is your department, and I greatly appreciate every single one of you. But this is at the expense of all of the children in the city, and I don't think we should have to wait. I have leukemia. My mother died of cancer. My mother lived right next door to the school. Every woman on that street on Davis Street has died of some sort of cancer. Was it chemicals used? I don't know. But in the past, I have no idea. But I really would like to get to the bottom of it for the safety and the well-being of the children. This is a health issue, and I just don't understand it. And as you can tell by my voice, I'm frustrated at this point. I think I've been so far more than reasonable trying to get to the bottom of it. My granddaughter had this in her hands, and that should not have been there. The next one that we found should not have been there. I'm just really disappointed. I don't know what else to say.
Marianne, go ahead. Sorry.
Marianne, it's not your job to do this, but you mentioned that you'd been in contact with the school committee. Can you remember how long ago that was?
I can go back in my email. It was the day of, and I believe it was September. It was either April, I don't know which was first, April or September. 2 different times that we found a rat box. One was in April and one was in September, and I can't remember off the top of my head now because I'm just so worked up, which was which. But it was well over a year and a half ago. And I contacted the school committee immediately. And Laura Weeson was the first one to get back to me. And she said that she was not familiar and she would pass it along. And then I went to the school committee meeting. I spoke during oral communication. Of course, nobody got back to me. I went back another time and spoke again. No one got back to me. I've been in the city hall to the mayor's office. Nobody got back to me. And that's when I reached out to Rachel and Max. I had actually sent Max, I believe, an email before I was in contact with Rachel. And Rachel's the one that really spearheaded this. And I give all the credit to all of you for at least trying. But you're the Board of Health. You're the people that ultimately are the ones that really need to oversee this, in my opinion, and act on it. And I just, like I've said at previous meetings, I don't want to get anybody in trouble. I want to protect the kids. And that is my sole reasoning for being here and being at any meeting, is for the safety. Always, I'm always at meetings for the safety of the children, and I'm not seeing it. And we should not go this long without having an answer. There's no reason why there shouldn't be
Mary Ann,
answers.
thank you so much for, first of all, your patience and for your concern. Your concern and complaints are heard loud and clear by us. We appreciate you speaking on it. Just want to address a couple things that you said. First of all, the contracts piece, I'd be happy to follow up with purchasing about that. That's a more immediate action that I can take to clarify things. When I first inquired about contracts, I was sent the POs. But I can clarify that. I can get more information in the next month about that. However, whether or not these pesticides should exist and be used within the schools is a matter of the integrated pest management plan. And changing that is going to be quite a process. I'll absolutely advocate for public health throughout that process. However, it is going to be something that is a bit time consuming and requires collaboration with multiple city agencies. So in the meantime, I will absolutely do my best to get you timely answers about these details. But just so that you know that in a month, we'll be starting the process of forming a committee to approach this, and it will take some time for changes to be made, unless there's avenues that I'm not aware of. That my understanding is an IPM process is the way to go.
I thank you for that, Rachel, but shouldn't that process have been started the first moment that I put in a complaint?
I hear you, and I think that the first priority was getting the information because we didn't even have access to those integrated pest management plans in the beginning. So as of last month, we have that. I do apologize, there hasn't been movement on it since last month. This is the type of thing that's very difficult to make progress on without people in the same room with each other. But I make sure to press on it.
Thank you. I will say that I looked up the East Gloucester Elementary Outdoor Integrated Management or IPM plan. I have it here from 10/28/21. So, and that may even be the second one that I pulled. No, it's actually the same date. So, you know, we're going on how many months now? So I just feel like it just keeps getting pushed and pushed and pushed and pushed. What I feel and how I felt for a long time is that they're waiting for me to get fed up enough that I just go away. And it's the safety of the children. I'm not going to go away. I'm not going to go away. I just want, and I see Eric nodding his head up and down. I don't get this. I don't understand why this isn't like one of the top priorities. The safety of our children, the Board of Health should be the most important things in and around our schools. And evidently there are people, and I'm not saying it's you, but I'm not trying to assume and I'm not trying to accuse, but there are people that are letting this fall through the cracks, and it shouldn't be. I'm just really frustrated at the expense of the children. So I've said
We
enough.
hear you.
I've said enough.
Thank you, Mary. We will continue to work on it.
Thank you for your persistence, really, in keeping this in the forefront. It's such an important issue. And so
I love children. I love children. And I've participated for years in school committee meetings because I really love them, and I've always tried to participate and volunteer and do my best. And I've lived next to the East Gloucester School for 61 of my 62 years. So, you know, I take care of that playground, and it's really important to me. It's a part of who I am. And I wanted to, I really want to give back to my community that's been so good to me. And it's really important. So, and I think this is one of the most important things that I've seen over the years is you know, the neglect of taking care of the pesticide problem here. And it's a big problem. So thank you.
I appreciate your concern.
Thank you, Eric. I appreciate that.
Thank you, Mary Ann. I guess that brings us to concerns of the board. Any comments?
well, I will bring up my usual, what seems to be this usual thing. We talked about having a party for Max, a board, taking Max out.
Yeah, yeah.
Apart from the staff party, which was really lovely, and I know how much he appreciated it, but it's something that the board does separately. So I haven't spoken to him, but I thought maybe we could come up with a couple of dates and then I could, run it by him.
Sure.
So I was looking at, Thursday seems to traditionally be the night. So I was looking at the August 18th or the 25th. And so those are just two I'm throwing at. Anybody has any other ideas if,
I mean, Maggie may tell me otherwise when I get
Right.
home, but either of those days look fine right now for me.
what about for others?
I can do
I
the
could do-
25th.
The 25th?
Mhm.
Okay. Eric? You're
I can
mute,
do,
sorry.
We didn't catch that there.
I can do either one.
Okay,
Okay,
so. So I'll ask Max about the 25th, since that's the one Kelly can do. If somebody gets home and looks at their calendar or whatever and finds that they can't, just, text me or email me. So otherwise I'll reach out to Max and we'll just go from there.
Yeah.
If he can do that, it'll be easy. We talked about doing it where we did it before because it just seemed like that was a nice atmosphere. So I will do that and get back to you all. So
anything else?
we don't know where Don is. We haven't heard from Don. He hasn't called in.
Did you get anything, Rachel?
I did
No.
not. Hopefully it's all right. I'm sure.
Any other comments?
Nope.
Motion to adjourn and
Motion to adjourn.
second?
Second,
All in favor?
aye.
Claudia,
Aye, yeah, yes.
Aaron, aye. Joe, aye. Rachel especially.
Aye. It's breathing in here.
So our next meeting is September 1st, right?
Yeah.
Yeah.
And it'll likely be here as well, right, Rachel?
Yes, it will be here hybrid.
Yeah.
Going forward, unless for unforeseen circumstances, things change with COVID. This will be the plan moving forward.
We could actually accommodate some people here.
We could.
So if there was another case, with an individual and perhaps their lawyer or other family member, it's a small number. I think it's good to have them
Okay.
actually be here.
But Joe, I thought it was more, for the city in terms of safety of the board members with COVID and such that we were
That's
trying,
probably true. Yeah, we still
that we
are.
were trying to keep down the numbers.
Yeah, you're probably right.
And
Maybe
that
if-
I know that it was the way it was with the city council, that they wouldn't, because then if more people came,
Yeah.
I mean, I think I would feel more comfortable and safer,
Yeah, no, I think you're right. That
so,
maybe in the future when things return even more normal.
yeah, let's hope that comes soon. So
All right, well.
Okay,
keep an eye
well,
on this.
we are adjourned.
stay
right?
cool without being too cool, right, Rachel?
Yeah. It's really just.
Everybody.
Okay, good night.
Bye.
Thank you all.
Thank you.